The Amsler grid is a test of central vision. So it's just, we use it as a way for patients to be able to check their vision at home, because especially when you're moving around day-to-day life with both eyes open, if one eye is a little bit off, you might not notice it. Whereas doing the Amsler grid, forcing yourself to go one eye at a time
Mm.
and just check that, just lets us pick up any problems of the macula as early as possible. So, traditionally it's been a way to screen for wet macular degeneration, but any problem with the macula, the very central part of the retina, will show up there. So whether it be swelling from diabetes or a retinal vein occlusion, or any of these what we call vitreomacular interface disorders, which is what we're talking about today.
Mm.
As you said a little bit earlier, this is a talk full of things that are hard to pronounce, so we'll do our
we'll,
best. But
we'll use lots of acronyms today, I think.
yeah, exactly. Well, I think ophthalmologists are attention deficit. We love our acronyms. But yeah, so the Amsler grids are used for any condition where we're concerned about changes in the macula, just because it helps patients to pick up changes in their vision as early as possible, so that they can let us know about it and we can get them in and have a look and hopefully pick some of these things up before they cause permanent damage.
Okay. And so how can patients tell if the distortion that they're experiencing is coming from the macula versus something else like a lens issue or refractive issue?
Well, generally, so most of those other things like refractive issues, so problems with the lens, problem with the surface of the eye, problems with the focusing of the eye, they'll generally cause blurring.
Mm.
So either just everything's generally blurry, or maybe you're getting starbursts and halo light sources and things looking smeared, whereas they won't tend to cause what we call metamorphopsia, which means the actual waviness and distortion of straight lines and jumbling of letters, that sort of stuff. That those features, those things where a straight line looks wiggly or where everything looks kind of pinched into a point, that kind of distortion is very distinctive, and really points us towards a macular problem. Whereas, the kind of generalized blurring can be caused by lots of different things.
Mm. Okay. And does everyone with wavy vision need to see a specialist right away, or are there cases where it's just something that'll settle down on its own?
Generally, if it's new metamorphopsis, so new waviness in the vision, that's not just kind of blink and it clears. If it's this waviness that's there all the time on the Amsler grid, maybe you check and think, oh, that's a bit unusual, and blink a little bit, put your lubricating eye drops in, and a couple of minutes later look again and it's still there. If it's new, you really need to get someone to have a look at that, because we don't want to muck around with macular problems. They can be, not all of them, but some of them can be potentially very serious and vision threatening, and we really want to get on top of these things as early as possible.